Okay, morning everybody, and a warm welcome to this morning's session on lifestyle medicine in practice. 4 years ago I came to VegMed. I had just sat the lifestyle medicine diploma, and I don't think I ever thought that 4 years later I'd be standing here chairing this session. So I'm really excited to be here. I'm really excited to introduce and hear our wonderful speakers. I think you're going to have a really enjoyable and inspiring session, and I'm just going to start with a quick overview of what I'm going to go through this morning before you can hear the rest of our speakers. So just in this short presentation, I'm going to cover what lifestyle medicine involves and why we so desperately need it in today's society. I'll share a bit about my own personal journey into lifestyle medicine, and as well as a bit of information about where I think lifestyle medicine is headed in the future. I should disclose that I have co-founded with Shireen a private lifestyle medicine healthcare service called Plant-Based Health Online, but I don't have any other disclosures. So what exactly is lifestyle medicine? Well, for those of you who haven't heard about it already, I'll just introduce it just now. It's a fairly new movement in medicine still today, but it uses really simple but powerful interventions to prevent, treat, and in some cases reverse many of the common chronic diseases that we see so frequently in the consultation room today. Things like heart disease, type 2 diabetes, and certain cancers. Lifestyle medicine is evidence-based. It's not alternative or complementary, but it does work really well alongside conventional medicine, or sometimes even as a first-line approach instead of drugs and surgery where this is appropriate. The research predominantly focuses on the chronic conditions like I mentioned, but the changes that I've mentioned fall into the 6 pillars as defined by the American College of Lifestyle Medicine, and you can see them here in the diagram listed on the left. It's a whole food plant-based diet, physical activity, restorative sleep, stress management, positive social connections, and avoiding harmful substances like alcohol, drugs, smoking, and vaping. So I think what's really exciting about lifestyle medicine is it can be practiced by many members of the lifestyle medicine, or the healthcare team, I should say, and it's really relevant to so many different areas in medicine. There's just an abundance of evidence for using it for all people of all ages, genders, different social and cultural backgrounds. I think what's so exciting about lifestyle medicine is that it offers an approach that can really get to the root cause of disease rather than just managing symptoms. And you can see why we need lifestyle medicine so much, why we need a fresh approach like this to healthcare. Non-communicable diseases, like some of the diseases I've already mentioned, heart disease, stroke, Alzheimer's, are collectively responsible for about 74% of deaths globally. And what's really important about this is the majority of these occur in middle to low income countries. Excuse me. This epidemic of NCDs poses, really devastating health consequences for individuals, families, communities, but it also threatens to, if not already has, overwhelmed healthcare systems. And the social economic costs associated with these diseases are enormous, and so it's just really important that we make some urgent changes with this. As I've mentioned, there's robust evidence that using a lifestyle medicine approach works really well with these diseases. And you can see why when you look at the risk factors that drive these diseases. In fact, one of the most important points to remember is that 80% of these diseases are caused by just 5 main risk factors. And when you look closely, you can see that most of these are related to diet and lifestyle. And I think this is really exciting, actually, because it leaves a lot of room for patients to make healthier decisions, healthier choices, and take some control and responsibility over their health. So there's numerous studies showing how successful a lifestyle medicine intervention can be, and these are just 2 that I've picked to demonstrate how powerful they are. The top study, run by David Katz, shows that 4 healthy lifestyle behaviours can reduce up to 80% of chronic disease and premature death. And the bottom study really was able to reproduce this with similar behaviours, resulting in a similar significant risk in lowering chronic disease. I think what's important to note, though, is that in reality, very few of our patients are following or implementing these health behaviour changes, and so it's just prudent that we take lifestyle medicine into the consultation room now. Now, this diagram shows how a healthcare system could work with a lifestyle medicine first approach, and as such, how it could work much more efficiently. As it stands now in allopathic practice, we really focus on the top two sections, that's surgery and prescriptions. And of course, there's times where this is really important and life-saving even. But if we ignore what lies below, then we run the risk of only treating the symptoms of disease. So we know that using low-cost, low-risk, simple lifestyle interventions can be powerful and effective. And if you can see the phrase beside the apple there, I think it's very true. They can be the cause and the cure of many diseases. Okay, so this is one of my favourite diagrams. I put it in most of my talks about lifestyle medicine. It was a diagram taken from the Lifestyle Medicine Research Summit, where thought leaders and experts in lifestyle medicine gathered to talk about the current knowledge and any research gaps in lifestyle medicine. And I think what this is really showing is that a lot of the research that many of the common chronic diseases, which you can see in the grey hand box there, that they result in dysregulation of the microbiome, epigenetic changes. These are driving cellular stress and injury, which then drive inflammation. And the inflammation then drives further changes to the microbiome, epigenetic changes, and cellular stress, for example, and so on. So I think this really sums up why healthy lifestyle changes are so beneficial in many diseases. You know, there's the same underlying biological cause, mechanisms, and pathways. And this is really different to what I was taught in medical school, which was some time ago, but even still, we learned different systems, different diseases, different treatments. But when we understand this diagram, it allows us to understand why the same lifestyle changes, so improving our patients' diets and stress and sleep and so on, can be so beneficial. You know, it can treat their comorbidities in synergy. Because when we understand this diagram more clearly, we can understand that all these diseases are interconnected. So I have learned in lifestyle medicine that it can be really helpful to share some of your own personal story, and my journey into lifestyle medicine started when, after having been some time being a doctor, I became a patient. I had a significant health scare which turned me to plant-based nutrition. I started following a whole food plant-based diet in order to reduce my cancer risk recurrence and to reduce my cholesterol. When I had some personal experience with that, and when I felt confident in the evidence that I had taken on board, I started to share it with my patients. And I started to see them in a very short amount of time improve their diabetic control, reduce their blood pressure, reduce their cholesterol, and I knew that I was on to something really exciting. At that time, I was living and practicing in Toronto, and Boston wasn't too far away, so I took myself there to the Harvard Medical School. They run a really great lifestyle medicine course. And it was there that the pioneer of lifestyle medicine, Dr. Dean Ornish, used this cartoon in his talk. And I had such a light bulb moment when I saw it, which is why I've got it here in my talk today. So you can see two doctors are wiping water off the floor, and they look like they're doing this quite frantically. But in the background, you can see that the tap is on and the water is overflowing. This made me think many times that I had prescribed for my patients, but never addressed their diet or lifestyle, so their disease would have been continuing in the background. So shortly after I had attended that course, I came back to live in the UK in about 2019. I sat the diploma with the International Board of Lifestyle Medicine. I came to VegMed, like I said, and shortly afterwards set up Plant-Based Health Online, like I mentioned. And I'll talk about that a little bit more in a few slides. So although lifestyle medicine is not fully embedded in the medical curricula at the moment, a number of medical schools across the country are showing some interest and enthusiasm for lifestyle medicine. While some medical schools are teaching on the subject, student interest groups are forming and starting to gain some momentum. And certainly in the US, residencies, internships, and even intensivist programs are being offered, which is really exciting. There's a number of societies globally. Each of them offer a range of educational offerings and certifications, for example. The Lifestyle Medicine Global Alliance was founded by the American College of Lifestyle Medicine in 2014 or 2015, I believe, and it continues in its mission to unite all lifestyle medicine professional associations. It calls for a united front to fight for much needed and positive change in the medical system to improve our patients' lives across the world. Okay, so I mentioned, this initiative earlier. Dr. Jane Kostelnik and I launched Plant-Based Health Online about 2.5 years ago, right in the pandemic. It's a community interest company. We're registered with the CQC. We offer a lifestyle medicine first approach for managing chronic conditions, and we have one-to-one video appointments, and we run virtual group consultations as well. It's certainly been a bit of a roller coaster in the last couple of years. Most of our success and satisfaction has come from our patients and their incredible health outcomes. That has been really rewarding for myself as a clinician, but also for the patients as well, who have completely changed their health trajectories. But there's been a number of stumbling blocks as well. You know, we've come across a number of barriers where the majority of the public don't really understand yet, or they're not super aware of what lifestyle medicine is and what it offers and the value that it could bring them. And we've also had kind of blocks in trying to seek support or collaboration with the NHS and other stakeholders, but we continue on. So I just wanted to end there with some of my favourite lifestyle medicine resources. The Journal Family Practice has an excellent introduction to lifestyle medicine. You can find this online. Another great paper that's worth reading was the brief review of the dramatic impact on health and survival of lifestyle medicine approach. And then I think one of the best books that I've read, What's Missing from Medicine. And then I'll just end with this, which is exciting news. Shireen and I co-wrote this course on lifestyle medicine for cancer prevention and survivorship. It's run through the University of Winchester. It's fully online, it's globally accessible, and the British Society of Lifestyle Medicine have accredited it with 15 CPD. So thank you very much for paying attention. I'm now going to introduce Jane Kostelnik. She's going to speak on the Whole Life programme that she's running in Devon, and I'm very excited to hear you speak.
Well, thank you for inviting me here, and it's really great to be in this community for the weekend. This is my first VegMed conference, and indeed my first conference as a speaker, so I'm very pleased to be here. My name's Dr. Kostelnik, Jane Kostelnik. I've been a GP, a UK-trained GP for about 25 years now. And I'm here on rather an unexpected route. I feel that this time in my career is totally unexpected. About 5 years ago, I was a partner in Wiltshire, happily ensconced in my practice for 16, 17 years. And I came here, really, I've arrived here from the perspective of my passion for the planet, and the planet's health, and human health, of course, otherwise I would not be a GP. I became conscious of global warming from my armchair, and over the years had been following the COP and the science. But it wasn't until about 2018 when my teenage kids sat me down and they gave me the talk. They gave me the talk about the birds and the bees, and about how urgent things were for the birds and the bees and humans because of the climate and biodiversity crises. Being a family of reserve, I was shocked, but somehow find myself on the streets of London with my family, with thousands of other people in the original Extinction Rebellion protests. And my family took it to heart. Some of us got arrested, one of us went to prison. And then I joined the Extinction Rebellion group and the Aligned Health, it was called Doctors for Extinction Rebellion, it's now called Health for XR. There's a stall out in the hall that you can have a look at if you haven't come across it. And it was through that diving into that in a deep way, both intellectually, academically, and through health, and through on a personal level, that I discovered plant-based nutrition. I became a plant-based GP. I started looking at this science and was shocked to find the wealth of evidence that's been around for many years about this subject. And so, not for that reason, but at the same time, my family and I moved away from Wiltshire into Devon. And that gave me the opportunity to do something different. So I became a locum GP, moved to Exeter, and then became involved in practices in Teignmouth and Dawlish. I've put this slide up and I searched for something to represent Devon and found the Devon flag, which says cream first. So I do have a conflict of interest to declare. I don't like cream. But Devonians versus Cornwallians, I know I'm not saying that, right, have this historical battle about, do you put the cream on your scone first or the jam? I personally would not have any cream, but that's because I'm a plant-based GP. But anyway, I'm now practicing in Devon, in the coastal region in Teignmouth and Dawlish. I've been a locum there in those practices for 3 years. Through that, I happened to come across a GP in one of the surgeries who, with her colleagues, had started a unique pilot amongst the staff for the staff well-being, introducing pillars of lifestyle medicine to their staff and just giving it a try with some health metrics collected from them, blood tests and blood pressure and weight measurements, and to see how they liked it. And part of that was asking them to try a plant-based challenge, a 21-day or 28-day plant-based challenge. And this became the whole life program in time. I joined my colleague Jenny Corser and some dietitians who staff have come and gone, but I joined the project and we started to develop the course, and then we launched it in 2019 to the practices in the PCN, to the patients. A free course, and it's based on. It's because of well, you've heard many speakers talk about the frustration of long-term conditions and the wave, the tsunami, really, of chronic disease that overtaking our NHS and using up its resources. And so that reminder of where we've come from led to the biggest health question being considered in our developing of the whole life program. How do we prevent these long-term conditions from starting? You know, what is it? What's it going to be? A diet, lifestyle, exercise, pill? So what happened then is that we decided to base the program on 3 essential things, which you'll recognize as 3 of the 6 pillars of lifestyle medicine. We introduced a topic on healthy diet and asking people to consider switching to a whole food, whole grain, plant-based diet. Focusing on how to become more active. We use the word physical activity, the phrase physical activity, because exercise puts so many people off. And then looking at social connections and the purpose of being in a community and being amongst other humans. So we chose those 3 as the 3 essential things to base our program on. And so what do we offer? We offer a 7-week online, mostly online program that's delivered in 7 packed 1-hour sessions that are part educational, part motivational, with the added benefit of peer support. The program also involves a dietary challenge, which is a 4-week challenge within those 7 weeks, where we encourage participants to adopt this whole grain, whole food, plant-based diet. And I'll tell you a little bit more about what that means, what we tell them it means. We provide GP coaching and dietitian support via the group. They are groups of patients in these 7 weeks, and individually if needed. We give practical guidance on implementing a whole food, whole grain, plant-based diet, because it is quite, for most, it's a foreign way of eating. They're not familiar with the foods or how to cook them. We do take pre- and post-measurements, health metrics, blood pressure, weight, blood tests for lipid profile, and HbA1c in the majority of them. we support the group with, in the community, and we ask them, the peers, support each other. We use Facebook for private groups to help them connect and communicate with each other. We also post supporting information and answer participant questions as we go along via our social media. And to support the activity and the physical activity and social connection element, we hold a monthly outdoor social event. Currently that's using the local, Tinmouth is a local town, using their local park run where we meet once a month and encourage them to run or walk with us, and then meet us at a local plant-based cafe for some social and some nice yummy plant-based food. So the 7-week course, this is just an outline, an overview of some of the topics we discuss in the sessions. As I said, we have about a 20-minute part of it where we present evidence. You can imagine that's quite packed, given the wealth of evidence that you've all seen this weekend that we can choose from. We offer motivational tips and techniques using group works, peer support, breakout rooms, top tips for making changes, behavioral changes. We provide nutritional education because we do have dietitians on the program with us, offering their expertise. We present health facts about exercise, social connections, sleep, stress. And of course, we talk about food and the environment and the facts around the global industrialized food system and its contribution to the climate and ecological crises. But this slide shows you what we mean by the whole life challenge, what we ask patients to change to. There isn't any meat on this slide, but and we don't ban meat. We don't say you can't eat meat. We have to do 100% perfect because I'm imperfect. Much as I try, I do sometimes eat things that aren't so healthy and aren't so plant-based. But so we do allow people to pick and choose and change how they want to, and depending on their baseline and how far they want to go, because it's quite quick. It's a quick 7 weeks. Who are our graduates? Well, all sorts. Majority of people who join the course are overweight or obese, as you can imagine, because that's how life is in the UK and other countries. Some have multiple long-term conditions and polypharmacy. We ask them not to stop any medications unless their own GP is specifically working with them on that. Some were already athletes competing in amateur sports such as triathlons and wanted to know a lot about protein and performance. Some were new to exercise, and the majority were eating standard Western diets, mixed omnivore diets and lots of processed foods. Here's a slide that is not fully up to date because it ends with the data ending in December 2022. We run about 5 groups a year, so we're missing the first 4 groups data from this year. But you can see that over those 11 groups, the average, there was weight loss on average. There was average blood pressure changes for the better. The average change in cholesterol and HbA1c were sort of befitting of what we'd expect, what you see from other presenters here, and the data that you expect from the studies, the evidence behind plant-based diets and health effects. You probably saw that we did have some real big excess, a shockingly big drop in HbA1c in one patient by 22%, which was just absolutely astounding. He wasn't on any medication. He was a newly diagnosed diabetes person, and you can imagine what he felt like. He was overjoyed. So we've had some great successes. Not only that, we do sort of pre- and post-course surveys about how they're feeling, and what comes across most strongly in terms of feedback from participants is how they say they feel by the end of the course, in just 7 weeks. Very many of them say that they feel more energetic, they're happier, they're sleeping better. They generally have an overall feeling of a better sense of well-being from the changes they've made to lifestyles, and that's obviously, just the plant-based diet. No, it's obviously a mixture of things, but it's very rewarding as a clinician to see these kind of expressions from our patients of how much how much better they're feeling. So I just wanted to highlight a few sort of success stories. These are actual patients. I've obviously changed their names and a little bit about them, but in essence, this is who they are. So Simon was a 50-year-old man who had type 2 diabetes and obesity, and he was at a point in his life where he had sadly become recently single. He was living alone. He wasn't very happy. He didn't like to cook. He hated cooking. By the end of the course, he was embracing cooking. He was cooking for himself. I think he was obviously even maybe cooking for his dog, I suspect, because his dog became healthier alongside him. So he had an 8-kilogram weight loss, and he's the man who dropped his HbA1c by that huge amount. He became an avid dog walker. He and his dog became well known and well recognized on the footpaths around Teignmouth and Dawlish, because he would go for very long walks daily. And we'd often bump into him, and he came to our socials as well. And so he was one of the people that was over the moon. He has a testimonial on our website where he sings the praises of the program. Mary was 62 when she joined the course. She was a competitive sportswoman in her early adult life, loved sport and loved competing. But sadly, she developed osteoarthritis in her 50s, and she described herself as a yo-yo dieter of many years. So her weight had ballooned over 20 years, and she wasn't very happy about that. She couldn't even walk really on the footpaths. But by the end of the course, she said it had changed her life. She had lost 10 kilograms. She was continuing to lose weight and make changes to her diet and exercise programs. She took up long distance hiking again. She did have a total knee replacement in amongst that, but she now declares that she's got her life back again, which is lovely. And then I wanted to highlight Jack, who surprised us by stating, he was very quiet during the course and didn't say much, obviously got on with the changes, and then told us at the end how much better he was feeling, because he had been a man who had been plagued for, I think, several years with chronic pain, chronic tiredness, no particular diagnosis. But just by changing his diet and tweaking his lifestyle, he was able to start feeling so much better that he could pace himself. He could now be active with his family, whereas he hadn't. He had to make excuses, and he had regained energy enough to play football with his sons and join his family activities again. So he came to the last session reporting this to our amazement, and it was very pleasing again to hear his story. In addition to the course itself, the sessions, we offer the community-based activities and outreach. So there's just some pictures of some of the things that we've got up to in the 3 years now almost that the course has been running. So we invite participants past and present to join us at the Teignmouth Park Run. Some turn up. So is some of these pictures. So the picture on the top right is us walking out on the seafront to the Teignmouth's welcome sign, which is on the cliffs above the sea, and having a competition as who could jump the highest. And I think that's probably Dr. Courser in the blue there. She was but we've done some outreach at local community food festivals. So on the left there is my colleague Ruth, dietitian, at our stall promoting the program and plant-based eating at an eat festivals, and that's with it was Christmas time, so people were dressed up silly and carrying monkeys for some reason. So we've had lots of activities down that, trying to ensconce us in the community. We had a couple of plant-based taster parties at a local community hall. That picture in the middle is the 3 chefs who are total volunteers. There's a local community center who's very well known for, they actually have at their heart, their aims, they've been running for 100 years, their aims are based on the 3 pillars of lifestyle medicine, promoting a healthy diet, which they're getting there, promoting physical activity. They run tons of activity sessions like yoga and dancing, Zumba, etc., and social connection, which they're well known for. They have a huge team of volunteers. So we try to ensconce ourselves in the community, and it has extra benefits running this program too, in that we are collaborating with Exeter University Medical School and Department of Nutrition and Dietetics, I think was his name. We're trying to launch some research studies, including, hopefully in the future, a randomized controlled trial of our primary care intervention, but watch this space. We are popular with nutrition interns who want to come spend some time in the project. We're popular with GP trainees. We've got an ST3 just joined us who's passionate about lifestyle medicine and plant-based eating, and he has joined us as an integrated care trainee, specifically asking for a program and looking. He sought us out because he wanted to do something lifestyle medicine related. And we're starting to get a lot of interest through coming to places like this and support from the wonderful plant-based health professionals, sort of just that community, just so we could find each other, because I'm not the only one, as you'll hear, running a program like this. So it is unique, and it's very much needed. My colleague, Jane Kostelnik, is pictured here on the left. Sadly, she couldn't be here. She was the lead clinician who was the one with her colleagues who started the initial pilot, the 28-day challenge for her staff. She is a passionate promoter of the program. And the lead. And Angeline Taylor is here in the audience because she is our wonderful dietitian on the project, and she's presenting her expertise in a session at noon, I think, in the other room, about renal medicine. So we've had the pleasure of having her on the team for the past year or two. Jane Kostelnik wrote this slide, actually, top tips for affecting change. So I wish she had been here to present it herself, because this is how she feels about the project, and that her passion and my passion and anyone who's joined us share that passion. And I think it's the passion that keeps the program developing and keeps it running and keeps it attractive to not just to patients, but to other people who want that kind of program. So, there's lots of things that you can do in the project that aren't necessarily just presenting in the program itself. Here's our website details in our Facebook page. There is an Instagram page as well that Jenny is in charge of. I'm not an Instagram person. And you can get in contact with us through our email address. So thank you for listening.
On. Can you hear me properly? Yeah. Thanks, Jane. It was great to hear about the Whole Life programme. And now I'm going to introduce Matt, who will talk about the Complete Health Improvement programme and some of his NHS Commission pilots.
Good morning, everyone. It's a pleasure to be with you, and thank you, Jane. That was, difficult to follow. I love the heart to what you're doing and how you've gathered so many people around it, and a very similar project to what we've sought to do with Compass Lifestyle Medicine. I thought I'd just similarly talk a little bit about my own journey into lifestyle medicine. So my background is as an ophthalmologist, although I really think of myself as a GP in ophthalmologist clothing, if such a thing were to exist. I've always been quite holistically minded, or certainly had a kind of whole person approach in the way I go about my clinical work. And a few years ago, probably about 8 or 9 now, found myself on HDU with septic shock, following a number of kind of challenges in life, work, through some work problems. We lost our home, and it was just a messy time, and felt terrible afterwards. Survived the sepsis, obviously, but just exhausted, and all the blood tests were normal, and my GP was saying, well, I can't find anything wrong. So it was really out of that background and wondering what to do next that I think for me, 2 things. One, from a kind of health perspective, that was my journey into lifestyle medicine, because I was looking for things that I could do that would make a difference. And I hadn't ever really heard about lifestyle medicine, but instinctively thought there must be something about the way that I'm living that I could change that might help. And another aspect was my own faith, my Christian faith, and just through prayer, just asking for help, because it really felt like life had hit the buffers. So I got interested in the whole person context in these two areas, in lifestyle medicine and in spirituality and health. And I ended up doing a master's in theology, spirituality and health, and becoming a chaplain, and worked in the Norfolk and Norwich Hospital during lockdown on the wards in chaplaincy alongside my clinical work, which was a huge privilege and simultaneously pretty challenging too, so you could imagine. And I had a vision, having largely recovered and got kind of life back on track, and feeling hugely grateful for that, because I couldn't have imagined that might have happened. I had this vision for what if there was such a thing as like a course that people could do, and you could, kind of gather some people around this course and maybe just train others to facilitate it. And really what you need is people who want to gather other people and to help them on a health journey. And as I was thinking that through, I set up Compass Lifestyle Medicine with the idea that, as a social enterprise, with the idea that, we could gather some people, try out some ideas. And then someone put me in touch with the Lifestyle Medicine Institute, who run the CHIP program. It was founded by Hans Diehl, who you may know died recently. And as I learned more about it, I just thought, wow, this is exactly what I've been looking for. And I thought, well, I'll get in contact. And we formed a partnership to bring CHIP to the UK with the vision of educating the professions, the healthcare professions in lifestyle medicine, using CHIP as an educational program. And also of delivering it in NHS and healthcare settings as an interventional program to patients. So I co-founded Compass with a fellow doctor, a stroke physician, and it's been quite a journey since then. That was 2018 was the start, and we've been through, we've had a lot of help through my membership of the Clinical Entrepreneur Programme, because innovating in the NHS is hard work, right? You meet barriers you didn't even know existed. And to comply with the standard contract for commissions, we had to, create all kinds of policies, and, it was a big climb. But we got there, and what I'd like to do is tell you a little bit about CHIP and then some of the results of our work in the NHS to date, and really just describe what, we hope will happen next. So we've already heard about the 6 pillars of lifestyle medicine, and CHIP. CHIP embodies all 6 of those. So there are modules on all of these areas, from plant-based nutrition, physical activity, and optimizing sleep, avoiding risky substances, and then growing and fostering those strong social connections around us, particularly in those key close relationships, as well as managing stress. I hope the slides will be available afterwards for anyone who'd like to see them, and you'll see it in better detail. But this graphic is trying to encompass the whole of health benefits of a whole of life approach. So this was summarizing data from a study of CHIP in a community of over 5,000 people in Illinois. Rockford was the name of the town, and the 5,000, more than 5,000 participants went on the program. It's fascinating how it created a cultural change, because people who weren't on the CHIP program but were acting as controls in the control trial, their own health was also improving. And it was observed in the city that restaurants were changing their menu options because demand was changing as a result of a locally focused, locally driven, and volunteer-led health mission. Let's make health go viral, really, was the message. And so, those people who started out with risk factors for health like poor sleep, high cholesterol, high blood pressure, those are the red areas in the diagram, saw that the prevalence in the group, fell significantly. So many people said, similarly to your setting, Jane, how they felt better, less feelings of depression, sleeping better, better mental clarity, more energy, lower BMI, lower blood pressure and cholesterol, and blood glucose. So again, as Laura mentioned at the start, it's these multiple benefits. In medicine, of course, we prescribe medication that target key causative factors or contributory factors, risk factors for disease. But a lifestyle medicine approach has multiple benefits, and I could talk about. Alongside diabetes, which is what this slide's about, cardiovascular disease benefits, the mental health benefits, the cancer risk reduction, etc. But just to focus on diabetes for a moment, of those in that large published study who were diabetic, if they were diabetic at the start of the program, within just 4 to 6 weeks, around just over a third, 35% of people were in the pre-diabetic range on their blood glucose readings, and 10% were in the normal range. Now, of course, that's not a definition of remission of diabetes, which is longer term, 6 months, and off all medication. But clearly, seeing significant reductions in glucose in such a short time frame is a huge encouragement to you if you've got diabetes and you want to take control of your health. So to observe measurable improvements so quickly is really, really exciting for all the participants and those leading the course. If you started out the program as pre-diabetic, then just under half were into the normal range. And around 40% in that study were advised to reduce their medication because their blood glucose had fallen so much. So in the last 18 months, we were commissioned by Mid and South Essex ICS to run CHIP programs. They commissioned 100 places as a pilot, asking the question, how would this roll here? We've seen published data elsewhere. How will it land in Essex? So just to describe what the experience of setting that up, the structure was that it would be GP referrals or practice nurses. So the surgeries would have a chat with patients, and if they were keen, they would then signpost them to the Essex Wellbeing Service, who would take a phone call, talk them through the program, and if they still wanted to go ahead, would then send the details to us. And that sounded like a reasonable approach, but it was very slow to get going. And thinking of the reasons why, I think the main ones are, when you do a small-scale pilot versus a large kind of push on something, it just takes a long time to get traction and for people to hear about it, and the kind of momentum that you need to try to drive things forward. So I think there's something about scale, but the other big issue, one of our learnings in Essex, was there's a very big something about clinician engagement. So if the GP and the health nurse doesn't really know much about lifestyle medicine or isn't aware of the impact on health and the ability to reverse disease, it's not going to be top of their thinking in their short time consultation. So I think two big learnings. In the end, we got 76 people referred, and most of those came in the last few weeks, actually, when we ourselves did road shows, met with GPs, 100 GPs in a meeting online, made a presentation. We had about 20 referrals in the space of 3 days. So it's that advocacy in that clinician and other healthcare practitioner engagement, which I think is so important. So we had 76 enrolled, and everyone did a before and after health status health behaviours questionnaire. Bloods, the same as in Jane's setting. And now we were relying on participants to report their own data. There wasn't a data sharing agreement in place with the commissioners and the GP surgeries. That's another thing we'll do differently next time, because we found that actually participants' willingness to fill in the online form, and it depended also on getting access to the blood tests from the surgeries, who weren't always able or even sometimes willing to provide that, which is quite surprising. But for what it's worth, the outcome data in those 26 who did did fill in, if you take the whole group on the HbA1c, the average reduction was 8.9 millimoles per mole. Sorry, I have changed that, but it hasn't come up. But as in most studies on lifestyle medicine, it's those who stand to gain the most who gain the most if they make changes. And so those who started out not well controlled, we called that over 60. The average reduction was nearly 16 millimoles per mole, and one chap came down from 125 to 60. The blood tests were about 3.5 months apart, and I thought, is that possible? I didn't realise that an HbA1c could drop that fast, but he was similarly over the moon, and so were we. And in the group setting, one of the most fantastic things is that those who are going for it and charging ahead are seeing gains quickly, and then those who are, I'm not sure if I'm ready for this, or I'm not so, activated and, motivated to make change, see the impact, and then it spreads through the group. So I love group coaching. I think it's a great tool to build community and help people on a health journey. Those who, of our 26, they're all diabetic to start with. 4 of them, so 17%, were non-diabetic, similar, a little bit more than the published study I showed you, 37 pre-diabetic, and diabetic, still in the diabetic range, 46%, although on average better off. 3 kilograms of weight loss in the time, with a maximum of 10 kilograms in the 3 months. And we got feedback from more people than filled in the form, actually, interestingly, but just talking about the encouragement of the facilitators, the knowledge, particularly the knowledge in the program, what they were learning that they didn't know. They talked about it was informative, and it was really setting a culture in the group, a kind of positive health promotion, positive focus, that, if you don't think it's possible to heal, why would you try? And so it's really important to share good news stories, be realistic, but also help people to, set their sights on something they might not have thought possible. Sorry, I'll just read this, but it was a letter from a GP to the local endocrine physician saying how great it was to see a patient recently who'd fully engaged with CHIP, who he'd copied in. He was more high-risk patient because he was on insulin, and he had concerns about him going on a program like this with dietary change, but his HbA1c had improved from 104 to 65. His cholesterol had dropped from just under 4 to 3.1, and he has lost 2 kilograms, feels a lot better, and his CKD2 has turned back to normal too. So just asking the question of the physician, how could we scale this up? We need more of this, do we not? How could we do that? And we're part of that conversation locally, and talking to the clinicians and the commissioners to see if we can go larger next time. Just to finish up, so I'd like to, we've got a cost effectiveness model that's been built by health economists from a consultancy in Cambridge called Costello Medical. It's a Markov-based model, so a change of state, diabetes, pre-diabetes, and normal. And it's asking the question, if you saw those same clinical gains in the studies of CHIP in North America, here in the UK, what would be the cost saving to the NHS for diabetics? I haven't got time to show you the whole data set, but if anyone's interested, I'd love to talk more about it. In essence, what they built in was all the data from HbA1c levels, blood pressure, cholesterol levels, age. It's a £40,000 piece of work. It's the team build nice cost effectiveness models, so it's a substantial model, and they then looked at outcomes, change of state to pre-diabetes and normal, and cardiovascular disease endpoints and mortality, as well as medication costs. And then all the costs are looking after a diabetic, screening for complications, medications, treating complications, which of course is one of the most costly things. So this bar chart shows you between 1 and 20 years the standard of care in red versus someone who just saw just the average improvements on a CHIP program, and in green. And if that's a line chart now that just shows what's the cost saving. You've got from £900 less healthcare spend in the first year for a diabetic patient who does CHIP, including the cost of delivering the program. So having paid for the intervention, the NHS would still be, it's calculated, around £900 better off in a year. And after 3 years, that's nearly £4,000. And if you multiply that up in cohorts, so say if 500 people did a program like this, it doesn't have to be CHIP, does it? What is it? Plant-based nutrition, move more, get better sleep, etc. For £460,000 better off if 500 people, less healthcare spend. Or, if 2,000 people did it, 1.85 million cost savings to the NHS in a year. Why are we not doing this more? Get to the cause, treat the cause. Don't just medicate it. We've heard that point made. And this was using Framingham modelling, the anticipated effect on cardiovascular disease rates, so incidence of heart disease, roughly a halving at all time points. So the main cause of death in diabetes halved in incidence by a lifestyle medicine approach. What next? Just to finish, well, we want to be. We're part of a movement, aren't we? And we want to grow that. So we want to educate more in the profession as to the benefits, because it's crucial to engagement. If your doctor recommends that you do a program like CHIP, you're 3 times more likely to engage with it. People take a lead from their GPs and their other clinicians. So if they're recommending it and embodying it, the patients will follow suit. And also, we're part of a pilot accelerator program, and through that and the Academic Health Science Network, talking to commissioners about deploying this in other settings, both to diabetics and in a heart disease and cancer setting. 2, we need more UK research, and we really need to know what the benefits are in the disease process so that people can engage with that. I've left my email address up there. If anyone would like to get in touch, come say hi. I'd love to meet you. And just to finish with a tribute to an inspiring man who had a vision that volunteers and others, anyone, could gather people and go, create some new friends and help them on a health journey. What would that look like if it went viral through our communities? Thank you.
Thank you very much, Matt. It's now my pleasure to introduce Dr. Ifeoma Monye. She's going to talk about lifestyle medicine in Africa and the Global South.
I have to put this down. It reminds me quite clearly some 8 years ago. We were in Lithuania with Hans Deal, bless him, and he told me, he said, come, do you know how Jesus changed lives? And I said, yeah, he spoke to people. He said, Jesus told stories. So he goes, in your walk in lifestyle medicine, make sure you tell stories. I've never forgotten that. So I pick up from where you stopped. I want to thank Shireen and the entire team of Plant-Based UK Professionals, Plant-Based Professionals UK. The same thing, isn't it? Thank you so much for inviting me. I have a very little time. I love to talk with people, so I'm going to try very hard to stay within my time. Now, look at the story. The first story I'll tell is this. Does anyone notice this? Yes, it's a kind of, do you see? So in Lithuania, we were traveling, so many of us from the US, Hans Steele and the great team, John Kelly, lots of them from the US, American College of Lifestyle Medicine, and a few people from India, I think, and so many other countries, and many Lithuanians. We're going to several universities there and also to the Parliament to talk about lifestyle medicine. Those are the early days of lifestyle medicine. It's so interesting to hear so much happening now, because then when we talked about lifestyle medicine, everybody said, what are you talking about? I remember my appraiser here in the UK, when I would be doing my annual appraisal and I was talking about lifestyle medicine, and he would say to me, well, you are a GP, so why don't you talk about general practice? And I just have a heart sink at me. Can you just get it? We need lifestyle medicine in general practice. So it's great that this is happening now. And so we went to the Parliament, and the table they brought was so tall that nobody could see my face. So they quickly brought a stool, and then I stood on the stool and I could talk. So today I said, you know what? I don't know if they're going to put a little table, so I'm going to get a Healy thing so that people will see me. So thank you for this. Okay, great. Sharing a few thoughts on lifestyle medicine for Africa and the global South. As it happens, I came into lifestyle medicine through my faith, my Christian faith. 20 years ago, I finished my general practice training in the UK. I had already done pediatrics and child health in South London, but I just was so drawn to families that I said, no, I think I'm called to be a general practitioner, not a pediatrician. So I went back and I did my general practice training in St. Guy's and Thomas's VHS rotation. And then my husband goes, we have to go back to Nigeria to help. I'm thinking, what? After spending a lot of money training, I can't even earn the thousands of pounds I'm supposed to earn. Back in Nigeria, my salary was going to be 10% of what I was earning here, but I went out of a dutiful wife. Okay. So the first thing I noticed was that there was no general practice in Abuja, which was the capital city of Nigeria. Anyway, very, very long story cut short. By God's grace, I created and established the first department of family medicine, is what we call it there, in Abuja. And I saw that there was a lot of suffering health-wise. Chronic diseases had become something I didn't see, because I did my primary medical degree in Nigeria before I came out to the UK. We didn't see that amount of diabetes. We didn't see that amount of cancer. It was frightening. So I went back, I said, God, what's going on? And the thought of lifestyle medicine, it wasn't called lifestyle medicine then, but just everything that we talk about now came rushing into me. So I began to find out who is doing this in the world. I discovered the American College of Lifestyle Medicine in 2009, and I joined it. And for the last 15 years, I've learned a lot, going back and forth America, and start being at the cradle of the start of so many other societies in the world. So I founded the Brookfield Center for Lifestyle Medicine got it registered about 20 years ago, but opened doors about 9 years ago. So 10 years is next year, and we're hoping to relaunch. Again, subsequently founded the Society of Lifestyle Medicine of Nigeria. And then when the BSLM started, which is Society of Lifestyle Medicine, I was one of the founding members, and I serve as a regional director there now. I'm a fellow of the American College of Lifestyle Medicine, and quite involved in the activities there as well. And most recently, I was elected the president of the World Lifestyle Medicine Organization. This is a sad and a happy note. This is my father, my mother. You can see him. He, jolly, lovely man, lived everything we talk about in lifestyle medicine, and so did my mom. My father passed away about 6 years ago at the age of 91. My mother passed away 2 years ago at the age of 90. In a country where life expectancy for men is 54 and women 56. But you can see what happened to my parents. That is their wedding day on the 27th of April, 1957. My father is a very romantic man. He died almost to the time he signed the dotted lines with my mother on their 60th wedding anniversary. So he passed away on the 27th of April as well. They lived a very happy matrimonial life and family life. But now, I put this up. The sad thing about what I put up is that that's my elder brother. We're 7 of us. He's number 3. He's not even number 1 or 2. In March this year, 2 days shy of his 61st birthday, so he was 60, he suddenly collapsed and died. And he's very aware of what I've been doing over the years with this, what we've been preaching in lifestyle medicine. I put this up to remind us that Africa has caught up. Africa has caught up with the pandemic of chronic NCDs, non-communicable diseases, lifestyle related. He didn't quite live the life my parents lived. I remember in those days when we were little, we had papaya, we had lime, we had guava orchard, we had all these things planted around us, and we ate every day. Everything that is described in the pillars of lifestyle medicine, we lived as normal. But when we all grew up, everybody did what they wanted to do. So that's the sad and the happy start of my talk. WHO has told us that much more of death and dying from NCDs is coming from low and medium income countries. The International Diabetes Federation, actually, just to put it in context, has predicted that in 20 years' time, 21 years' time, Africa would literally jump in the number of diabetes cases by 143%. And if you look at the rest of the world, all the other continents, nobody comes close with that jump. Nobody comes close. And I thought to remind us that it's not a Western problem anymore. We are seeing it happen every day. And I give this talk, I've given this talk for many years. I never knew that in this year, I'll be giving a talk that will come so close home because I'll lose my own brother at the age of 60, instead of my parents who lived till 90 and 91. Recently, a few Western countries, including UK, Switzerland, France, Germany, put up some strategies for preventing and managing NCDs. And you can see they have healthy lifestyle, healthy environment, 2 strategies, all the way to about 15 strategies for improving health and quality of life. So World Health Organization have brought out a lot of documents about strategies and so on. Tanzania is the only country I'm going to make mention of because of time in Africa, who in their 2016 to 2020 document for strategies to prevent and control NCDs, implemented certain things. Because if you look at Africa, many of the countries have huge and amazing documents. Nigeria, where is my country of birth, our most recent 2023 document is about 138 pages. And if you read it, highly cerebral, very good things. It is implementation that is the issue. But Tanzania went on to establish 26 regions. In 26 regions, they established diabetes and hypertension clinics. They trained over 2,000 healthcare workers looking after patients with NCDs. This was a period between 2017 and 2022 where more than 100% of more patients were managed properly for hypertension. And they did chronic disease management, healthy lifestyle, and healthy environments. Your guess is as good as mine what became the outcome. Of course, better outcome. This is Africa as God intended. You know, we have great weather, we have a lot of amazing fruit, vegetables, things that will not grow in any other part of the world, but will grow and flourish. Dense, high nutritious foods, we have it. But what has happened to us over the years? We've had urbanization, modernization, borrowing of the lifestyle of the West, and at the same time, borrowing the illnesses that come with it. And that's what informs all the predictions of doom about Africa if we don't do something about it. So you find out that still cardiovascular disease still tops it. The last presenter, the keynote speaker told us, showed a very lovely graph of that. Cardiovascular disease still tops. Cancers and chronic respiratory diseases. There's the 3 top causes. What is it with the letter C? In Africa, we have all of that, but also we have the challenge of COVID, conflicts, and climate change. What is it with the word C? On top of that, the cost of training physicians, lifestyle practitioners, and lifestyle professionals in lifestyle medicine is beyond the reach of the average African doctor, African nutritionist, African nurse or pharmacist. So we're dealing with triple, and some may argue even quadruple burden of disease, where, as you all know, when anybody thinks about Africa, they think, oh, communicable diseases, yes, malaria, cholera, TB, HIV, yes, those are still going. But imagine the double whammy of adding on the NCDs, as we can see happening right before our faces. On top of that, we have all of this going. So, what we have done over the last several years, in my introductory talk, I sort of introduced us to my history in lifestyle medicine, the global movement of lifestyle medicine. Countries have formed societies over the years. And this year, at the very beginning of the year, many countries from all the continents came together to establish the World Lifestyle Medicine Organization. Shireen has asked me to share a little bit more about it. So this is an organization that has been established by all the continents of the world, with representation from so many countries in those, all-inclusive, democratic, and legally registered with headquarters in Geneva. There are 3 elected officers, the president and 2 vice presidents. One of the vice presidents is Dr. Padmaja Patel, who is the president-elect of the American College of Lifestyle Medicine. And the other vice president is Dr. Rabani Tariq, who is the current president of the Indian Society of Lifestyle Medicine. And we have members of the Executive Council who are representatives from every continent of the world. What we want to achieve with the WLMO is to actually begin to look at moving the movement of lifestyle medicine to the next level, engage key stakeholders like the UN, like the World Health Organization, universities all over the world. We want lifestyle medicine to be recognized as a specialty, standalone specialty. We're making some progress in some countries where family medicine has adopted this as a subspecialty, but it's not happening in many, many parts of the world. There are task forces that have been established, and one of them I'll just refer to is the Education, Training and Accreditation Task Force, led by Susan Benigas, who is the Executive Director of the American College of Lifestyle Medicine. And one of the many things that they'll be doing, apart from sharing knowledge, helping with educating people all over the world, all cadre of health professionals, is to accredit lifestyle courses all over the world. So we understand and we recognize that there is a lot of diversity in the world. There are different challenges, the cultures are different. So even though the pillars and principles of lifestyle medicine remain the same, the application in each continent, in each country, is so different. The challenges that we have is so different. And so we acknowledge that and we respect that. And everyone has a voice. The World Lifestyle Medicine Organization is owned by the members of the General Assembly, and they determine what happens. And those are representatives from all the member countries. So now in Africa, what's going on? The Society of Lifestyle Medicine we're having our 5th scientific conference in November, December, 30th and 1st of December. And this year, that's just a picture representation of what we did during the May Lifestyle Medicine celebration week of the Lifestyle Medicine Global Alliance. And we had quite a spread. We threw out all the red carpets all over the country, and we did that. And we have other initiatives going. In South Africa, we have the South Africa Lifestyle Medicine Association. They are growing strong every day. In Botswana, the Botswana Association of Lifestyle Medicine. And then Egypt also, those are pictures of how they celebrated Lifestyle Medicine Week. We had an African celebration and met by Zoom on one of the days, all of us from all over Africa, to celebrate this. In Africa, we use the word dreams to remind people, to teach communities about the concepts of lifestyle medicine, and it's everything everyone has spoken about so far. So we dream of a time where health is as accessible, affordable to everybody. It doesn't matter how rich or how poor you are. I see lifestyle medicine, and I define lifestyle medicine as a democratization of healthcare. Laura, you said in one of your slides, you said that lifestyle medicine is effective for everyone, no matter the culture, no matter the size of your pocket, no matter which part of the world this is. And that is what is so exciting about lifestyle medicine and Africa. We are built for lifestyle medicine. Why do I say so? From time, the diet we eat is really plant-based. We have a lot. We go to farm. We farm all of these things. Remember, I said to you, my parents had all of this growing around the house. We plucked our tomatoes. We plucked our pumpkin leaves. We plucked okra. Everything was in the house. We planted it all around us. So diet was legumes, beans, and so on. That's what we grew up on. Relationships is our. And we talk, in Africa, we are very religious people. I'm sure you probably know that. And there's all kinds of religions. So in Aro, we recognize that we need healthy relationships, horizontal and vertical. Horizontal with you and I, family, colleagues, and everybody down here. And vertical, whatever represents spirituality to you. It's important that everybody has a sense of well-being. Like the Japanese, we call it the ikigai, the sense of why am I here? So that's what R represents for us. E is exercise, of course we know, regular physical activity. A is avoidance of anything toxic and addictions and so on. Alcohol, tobacco, drugs of addiction, substances of abuse. M is mental well-being, particularly stress management. And S, of course, is sleep. A quick one on the S. In May this year, when a classmates cruise in America, and I was sharing this with them, and my classmates said, "Hey, Ify, hold on. That S is sleep and sex." I said, okay. I'm going to remember to add that anytime I'm presenting this now. So they've added that on, my classmates, to that. So we share this in all kinds of ways, one-on-one with our patients in the room, but also virtual group consultations. And we found virtual group consultations very effective in that it's helped us to actually launch out a lot of programs. I don't have time to talk about the successes we have had with our virtual group consultation, but I just want to say that pretty much what my colleagues here have presented about those group activities you had, that was the design. That was the kind of comments people had about, oh my goodness. One of the people said, where have you been all our lives? We wish we found out about lifestyle medicine before now, because all their figures, all their values, everything responded just like it will respond in Dorset, in Devon, and wherever in Kent, wherever you are. It responded well. The Brookfield Center for Lifestyle Medicine, which I founded, like I said, this is the Brookfield, some of the pictures, where one of the things we have established as community engagement in lifestyle medicine is Go Green, Grow Your Garden. And this came about during the COVID period. As we talked about people should eat more grains, everyone complained that people are not in the market. How are we going to continue? And so we came on board with this. I said, you can actually grow your grain in your house. And we began to teach members. I have permission from all of them. This is one of the groups. There are several groups dotted about the city where mainly women, but we also have men who are members. Mainly women gather together in groups and teach about growing vegetables and fruits in their home. You can see there are different gardens here, there are different people, different homes, and that's just to remember to talk about that. That is going so well. People are harvesting so much vegetables, they are giving it out to family members and giving it out to their friends because they can't consume all of that by themselves. And we have WhatsApp groups where we share knowledge. Once a week, the Brookfield Center throws out information and continues to engage with them on even other pillars of lifestyle medicine. However, the main focus is on greens and gardens in your home. And I share with them what I eat, and you know, these are real pictures of what I eat, and they follow. The other way that we also reach the community is through physical activity, and particularly through dance. As you all may know, Africa is the headquarters of dance in the world. Yes. yes. Shireen, you didn't give me time. I would have, liked us to dance a bit, but she says, no, just give your talk and keep to time. Okay. Next time, I promise you, I'll share a dance with you all. So we do dance. It's very important for physical activity, for social connectedness, for just everything. And then you go home happy, full of joy, full of hope, and hopefully healing. So that's one of our groups, having the dance with the dog, and we also do walk with the dog in the center. That's the center, Brookfield Center. Just in closing, we are open to collaboration. So many of the activities going on in Africa, particularly in Nigeria, a lot of the diplomats, I didn't start just to let you know, I was one of the diplomats in 2018 in the UK, the very first exam that we did here of the International Board of Lifestyle Medicine. And we've carried that exam to Nigeria, and we have had a few diplomats in Nigeria. We have an exam in November this year where we're fielding 8 diplomats. There is a lot of problem with they're affording the exam, and all the time they're asking that this exam should be made more affordable so that people can do the certification. In the Society of Lifestyle Medicine of Nigeria, every week we teach, the diplomats teach, and and that's to members. But every month, once a month, we have a webinar, which is free for all, and we have numbers between 100, 150 to up to 500 sometimes attending the monthly webinars, and we teach lifestyle medicine. The WLMO, with all the countries involved, we have collaborations with them from Africa, gaining one thing or the other, sharing knowledge and getting support and mentorship. The nextgenu.org is a completely free resource, and that's very, very attractive to African health professionals because they don't have to pay. It's not an exam or anything, but they learn all the modules of lifestyle medicine, and they can get a certificate at the end. So that's they are so excited when we talk about it, and they want to know. They can't afford the exams yet, and so they go online and they learn as much as they can to enable them practice until they can afford the exams. We're open to collaborations. I put that University of Winchester to remind me to say that collaborations with anybody for research, for example, for knowledge sharing, for whatever it is that you want to know, how is it done in Africa? Should we also have a group in Africa researching this or that? We are very open to that. Just have a chat to me after the meeting. Have I run over time? I thought so. Okay. Thank you so much, and my apologies.
It was too good for me to stop you, but we do have some questions. Jane, there's a number of questions that have come, a lot of them really saying the same thing, asking for you to comment about how you got your programme funded and how you recruit local-based NHS staff.
So funding
and then recruiting of plant-based staff.
Plant-based staff?
Yeah.
Right, okay. So funding first. The program is funded by the Primary Care Network through the pot of money that's called the ARRS, A-R-R-S. I've forgotten what that stands for. It's the pot of money from NHS England that allows PCNs, groups of GP surgeries, to hire employees to support the GP team. So that would be first contact physios, social prescribers, health coaches, health and well-being coaches, and dietitians, amongst others. So that's why we have a GP health coach. That's me. I'm not paid as a GP. I'm paid as a GP health coach, and dietitians on the team. And so we've kept that model for the time being. So as you can imagine, it's not a huge pot of money to begin with, and this PCN has decided to hive off some of that to fund this program. So it's the budget is only for staff. anything else, the development of the course itself, the effort we needed to put into doing that was goodwill. And in terms of recruiting staff, it was recruited through the same scheme, the ARRS scheme. So, recruitment for dietitians, recruitment for GP or health coaches. So that's how we recruited. So.
Great, it's wonderful, thank you. Ifeoma, I think this is a question for you. Could you please comment on how you're helping communities overcome challenges of living in an unhealthy food environment?
Unhealthy food environment?
Yeah.
Okay. Actually, the program Go Green, Grow Your Greens, it's actually one of the ways that we are introducing that so that they know that they can actually grow their own greens. And something I forgot to mention, or I didn't have time to mention, is that we are also faced with the issue of conflicts, so that people cannot even go to the farms, that people used to go to. People used to have acres of land to just farm one thing or the other. But because of tribal conflicts, you go to the farm and the other tribe or the other religion that wants to get you off your land kills you or destroys what you've planted. So that was another big thing, and we had to continue to push growing your own greens right in the safety of your home. So I think that's something that we're hoping will catch on much beyond what we're doing so far, and so that people will feel confident to continue to eat healthily and have not just enough for their families, but even enough to give out to friends and the extended families, which is what is happening with those who are engaging with us now.
Yeah, that's an amazing initiative. We have so many other incredible and important questions, but we're running out of time, and I've been told many times to keep to time. We have a break coming up now for tea and coffee until 12, but I just want to take another opportunity to thank our amazing speakers. Thank you very much for today.